Good morning. It's 9 a.m. This is Cecil County Work Session of February 26, 2019. I'm calling this meeting to order. There are 5 members present, which constitutes a quorum. First of all, before I get into the agenda, could I have a moment of silence, please? As you know, what happened in the town of Elkton, we lost a figure that I think really represented Elkton. And I know myself, I tried to model myself a lot after what Mary Jo did. I liked her comments. I like what she did. She didn't talk just to talk. When she talked, she had something in mind that she said, and just the way she handled herself. So if I could have a moment of silence, please. Thank you. Okay, can I have a motion to approve the minutes of the council work session of February 19th?
So moved.
Second.
All those in favor?
Aye.
Opposed? The minutes are accepted. Okay, now we have a presentation, drug and alcohol overdose update. Want to welcome Laura Humphreys, Acting Health Director, who will lead the update on drug and alcohol overdose presentation. Thank you.
Good morning, and thank you for the opportunity this morning to provide updates on our county's efforts to address the opioid crisis. As you know, the health department is not in this fight alone. Cecil County has been recognized statewide for strong collaborative relationships that have been established to address this opioid crisis. Together with the Department of Emergency Services, the Sheriff's Office, the Department of Community Services, Youth Empowerment Source, and many more partners, we're tackling this problem through 4 pillars of action: public safety, prevention, recovery support services, and treatment. We appreciate having some of our partners here this morning, including Sheriff Adams, to support our presentation and provide insight if you have any questions. I'm sure you're all familiar with Ray Lynn from the Sheriff's Office. Ray is the heroin coordinator for Cecil County and does an incredible job of tracking overdoses in real time. You may have noticed that the official data that comes from the State Maryland Department of Health is generally 1 quarter behind in timeliness due to the processes involved in certifying and publishing the information. And the local data that's tracked by Ray, although it's considered preliminary, is actually more valuable to us to help us respond more effectively and timely. The state's data can often be different from what Ray has simply because the state relies on toxicology reports, et cetera. So things that we may not appear to be an overdose or alcohol or drug related death to us on the surface, a car accident, et cetera, could be later deemed to be problematic and contribute to the problem. So at this point in time, I'm going to pass it over to Ray, and once he's finished his presentation, we'd like to also address and share some things with you about what we're doing about this problem. And this morning, we also have with us Beth Creek, the Executive Director of Youth Empowerment Source, which is a local nonprofit organization providing services to at-risk youth. And we also have Virgil Boysaw, a Health Department employee and Drug-Free Communities Coordinator. And they're going to walk you through some of the exciting initiatives we have underway regarding youth prevention. So at this time, I'll turn it over to Ray, and I'll ask Mike Masuli, our Deputy Director of Addiction Services at the Health Department, to come to the table also in case you have any questions.
Okay, thank you.
Good morning. Is it okay if I sit here and run the computer?
Sure.
I do have a quick PowerPoint presentation. Make sure everybody can hear. Again, my name is Raymond Lynn, Cecil County Heroin Coordinator. I've been working in the county in this position since December of 2016. PowerPoint presentation. Basically, with this, talk a little bit about what's going on in the county, trends. I want to show you a comparison of 2018 versus 2017, and just a little bit about what's going on in 2019 with overdoses. First thing is, remember, I'm talking about overdoses, but the overdoses are such a small snapshot of the overall substance abuse problem within Cecil County and Maryland as well. It's very, very complex, and again, the overdoses are such a small snapshot of that problem. This represents Maryland as a whole for 2018. It's most of the overdoses that occurred in Maryland. Some of the counties aren't 100% on board with reporting yet, but as you can see, it's from east to west to north to south, and the triangles represent fatals. But it's certainly a statewide problem. For 2018, Cecil County, we saw 656 overdoses, reported overdoses. These are overdoses that reported to law enforcement, EMS, or somehow I found out about. These do not include the overdoses that are occurring in private residence where Narcan is being utilized. So just, again, a small snapshot of the overall numbers. We had 64 fatal overdoses last year with 592 non-fatal. This is just a basic trend line of last year by month. There was really no pattern to it. There's no single thing going on that I can say the overdoses caused, spike or not. But Cecil County map, this is all of the overdoses that occurred in 2018. They're represented by circles. Each circle represents a non-fatal. The colors represent Narcan or no Narcan. And the triangles represent fatalities. And again, from Conowingo to Warwick to Earlville to Glen Farms. Biggest concentration, though, is, of course, where the population center is. It's pretty much Elkton, northeast, right along the U.S. Route 40 corridor. That's not uncommon to Cecil County when you really look at it. Harford County, Baltimore County, pretty much right along the main routes, as well as Delaware and New Jersey, all the way to Ocean City. So that's not exactly uncommon to Cecil County. Or just Cecil. 2018, opioids were 93%. Of all the overdoses, some type of opioid or opioids contributed to the overdoses 93% of the time. I try to keep track of other drugs and other overdoses as well, but opioids by far are what's causing it. And 92% of those opioids were street drugs, the heroin, the fentanyl, and the mixtures, with only about 7% of the opioid overdoses being prescription medications. The antidepressants are also, they account for about the remaining 7% of overdoses as well. So, and polydrug use, that number 22% is, I'm sure it's low. Most overdoses, it's not just a single drug. It's typically heroin combined with Xanax, or it's heroin combined with methamphetamine. So most of the drug users use multiple drugs, and that accounts for some of the overdoses. Narcan, of course, we all know Narcan, naloxone. 447 overdose victims last year received Narcan. About 40% of them had to have multiple doses at the scene. But we had a 92% success rate. 410 lives saved last year by Narcan. And that's a breakdown of who's actually administering the Narcan, EMS, law enforcement, family, friends, bystanders. Again, the health department has a very large program to get Narcan out in public because it does help save lives. Last year, the average Cecil County overdose patient was somewhere between 28 and 35-year-old white male. The ages fluctuated a little bit during the year, but that was pretty much 28 to 35. Majority of the overdoses are occurring on Elkton, right around the U.S. Route 40 corridor, and the average overdose victim had overdosed at least 1.8 times, nearly 2 times when it was reported to me. Again, almost roughly 40% have a known history of previous overdoses, and with every overdose that's reported to me, it gets referred to the health department, and we made over 581 health department referrals last year. This is just a breakdown of the demographics, male, race, and sex. As you can see, it's more than half is males, white male, and again, 28 to 30. But there's not really an age range that hasn't been affected. Our youngest heroin overdose victims last year was 14. There was 2 of them, 14-year-olds, and they also received treatment with a couple of the programs. I put this up here not to be funny, but I try to show the impact on people. I took this picture. It was in the middle of the day. I was eating lunch at Pat's Pizza, and I saw this gentleman walk out, stumble in front of the building. I wasn't sure what he was doing. It looks like he was going to get something out of his bag, and he literally fell over, and then at that moment, he was unconscious. And we had to go out there and help him. I actually had to yelling at him and trying to get him to wake up. It didn't work. I had to actually slap him on his back, shake him vigorously before he stood up, and he told me they had just shot up heroin, and that he's a longtime heroin addict, and he was transported to the hospital and trying to get treatment. But unfortunately, that this happened in the middle of daylight. It caused quite a stir at the restaurant. People started panicking, and this is what we're seeing. Unfortunately, this is a real deal. I try to show this because I said the overall drug problem, the overdoses are such a small snapshot. This gentleman was a longtime drug user. He was injecting in his legs, and there are multiple injection sites that got infected. And when he's trying to shoot up, he'll pick the scab off and shoot up in his leg. It became, as you can see, a major infection, and he had to be transported to shock trauma and almost lost his legs. But again, it's a MRSA infection from drug use. Again, one of the problems that we don't usually think about, but it's out there. Again, this gentleman is unconscious from an overdose. He's standing up, and he had to receive medical treatment. Again, this is right here in Elkton in broad daylight during the daytime. Again, not to be funny, but this is some of the ways people are being impacted. Fatal overdoses in Cecil County for 2018, again, all over the county, from south of the canal to Rising Sun, Glen Farms, all the way to the very northern end of the county. Not too many communities that weren't affected. Again, there were 64 of them. The individual colors represent, the red represents a fatal where no Narcan was used. Essentially, they were found deceased and nothing could be done. The other colors represent life-saving measures where Narcan was administered, but it was ineffective. For the fatal overdoses last year, this is strictly fatal. 88% of them were fentanyl and fentanyl-related substances. When I say fentanyl-related substances, we're basically talking about the analogs. There's various analogs or types of fentanyl. Only 7% were heroin overdoses last year. That's 4 out of 64, okay? 4 people died of heroin overdoses. Everyone else died of fentanyl overdoses, and that's usually the fentanyl mixed with the heroin. We had 2 prescription opioid overdoses last year. Both were like Oxycontin. We also had 2%, which I believe represented about 1 Adderall overdose death last year as well. 85% of all fatals were poly drug use. There was a additional drug, not just fentanyl and heroin, but additional drugs related. Cocaine 15% of the time. Alcohol. Xylene is something that we see in this county. It's not really seen anywhere else in the state. Occasionally, law enforcement will make a seizure. Anne Arundel County had a seizure of it. But according to the MA's office, they're seeing the xylene only in Cecil County overdoses. Not really sure why. Again, what's different with our county than everyone else is most of our drugs are coming from Philadelphia versus Baltimore. So obviously, have some type of Philadelphia connection. And methamphetamine. 7% of the deaths last year had a combination of methamphetamines. Again, the average Cecil County fatal overdose patient was a 41-year-old white male. And he had overdosed about 1.4 times prior to that overdose. And almost every single overdose death last year, the victim had attended at least 1 inpatient treatment program, a full, complete inpatient treatment program before the fatal overdose. Again, one of the biggest impacts that we're having in this county and in the state and pretty much everywhere the drugs have become an epidemic is the impact on children. As we know, this is it can be generational. And last year we had approximately 50 Cecil County children lost a parent from a fatal overdose last year. So down a little bit from the previous year, but still 50 children were orphaned by at least 1 child or both. Children were present at the scene of approximately 15 to 20% of the overdoses last year. So, roughly 20% of the time there's a child or children present when the parents overdose on these drugs. They're seeing the drug use in the house. They're seeing mom or dad or someone overdose and fall out, have to be Narcaned, have to see CPR being administered, and in some cases, they are actually finding their parent deceased. We have an 8-year-old that I'm familiar with that it was normal to have to give Narcan to one of the parents before school in the morning. Pretty sad. Just a comparison of 2018. As a general rule, Overdoses as a whole were up, but fatals were down. So we did have a 17% decrease in fatals last year. Health Department referrals, 2017, we were just getting going with the referrals and figuring out how to do that. So we went from 385 referrals to 581. So we definitely increased that dramatically. And the average white male the average victim was 35 in 2017, and it did drop a little bit to 2018. So the victims have gotten younger, and that's one of the trends that I've seen recently is, in fact, I'm seeing more of the 20-something-year-olds overdosing for the first time with no history, and that continues today. Narcan administration's pretty close to about the same, a little bit more Narcan in 2018. But we did see an increase in multiple overdoses. So we had to give, in many cases, the victim additional doses because their drugs more likely was fentanyl. Fentanyl-related substances, believe it or not, it was 31% increase in 2018 versus 2017. So fentanyl problem has actually gotten worse. The drug composition has changed. We're seeing more cocaine, methamphetamine, xylene mixed with the fentanyl and heroin. And this is some of the fentanyl analogs that actually were involved with fatal overdoses last year. One thing that we have not seen in Cecil County is carfentanil. I know I get asked that a lot, but we have not seen it in other parts of the county. The state have, but we have not seen carfentanil yet. It is all around us, though. I believe Delaware and Pennsylvania has it just a few miles away. Again, increase in overdoses, a decrease in fatals from last year. I often get asked why the fatality rate decreased. Well, some of the reasons that I know of, and I've talked to the health department, some other, is, first of all, naloxone is readily available. A lot of people have it in the households. There's overdoses occurring sometimes in public where someone gets out of their car, walks over Narcan, someone gets in and leaves. I mean, so there's a lot out there. The post-overdose victim response and outreach teams, and that really comes down to the peer recovery specialists. They get out there and they're doing everything they can to go out there and make contact with the victims relatively short time post-overdose. And they're making a lot of headway. It's hard work. They're understaffed, I assure you, but they're working overtime to make it happen. So that's definitely one of the reasons why our fatality rate is going down. The increased communications between public and private health providers. I think that speaks for itself. We're communicating with the health department, private companies, law enforcement. Everyone is working together to get positive results, and it's showing in some of the numbers, especially with the fatals. The expansion of treatment and recovery services, and I'm sure Mike can tell you about that, but they're definitely expanding and getting better. The multi-agency law enforcement drug trafficking investigations, not just the task force, but Cecil County Sheriff's Office is working with EPD. EPD is working with the state police. Everyone is working much closer, and I'm a part of those investigations sometimes with helping connect the dots and going after the drug traffickers. Community and youth substance abuse and life skills education. Programs for some of the children are really starting to expand. Programs that the health department's doing, and they can explain. Mike will give you some more insight in that. But a lot of youth outreach programs, as well as Virgil's program with youth empowerment. So it is making a difference. We're seeing a decrease in deaths, that's for sure. But I also have to answer the question of why are the overall overdoses increasing? Well, the biggest reason is the fentanyl and the fentanyl-related substances. So we've got drugs, in addition to heroin, that they're putting fentanyl in, and it's causing overdoses. That's probably the biggest reason. We have high-dosage synthetic opioids readily available, meaning fentanyl. You can get fentanyl in Baltimore, Philadelphia, cheap, easy, just snap of the finger. It's all around us. We have a high rate of substance abuse and mental health disorders. We live in a small community. It's out there. Again, the overdoses are just a small snapshot of that problem. Family history. The children are growing up with us in the household. They're biologically predisposed to substance abuse and depression. We're working very hard to reverse that, dealing with some of the child trauma issues associated with it. And, the crackdown of prescription medications, it certainly has led to some of those patients going out to seek heroin and other narcotics, so I can't deny that. and the increasing supply of cocaine and methamphetamines mixed with the heroin and fentanyl. If there's one trend that I really would like to highlight right now is the methamphetamine use in this county has dramatically increased in the preceding months. We have had, in the last 30 days, 2 methamphetamine overdoses, strictly methamphetamine, not contributed with any other medical condition or mixed with any drugs. Both of those patients were in their 50s and 60s, but it's rare to see a methamphetamine overdose death. But we've had 2 of them. So that is something that I know the health department is working to address, as well as some law enforcement. Most of this isn't the methamphetamine that they're cooking in their garages or their basements. This is crystal meth. It's coming from south of the border, being smuggled across into the United States, and in many cases, U.S. mail or private vehicles are transporting it from western states to the East Coast. But it is very prevalent. Everyone seems to have it. Some inside information I have, from the users, the heroin users, as well as even some people with the medication-assisted treatment, is that they're using meth during the day to keep them from getting sick and maintained in between the heroin doses that they get. So meth is really big, and it's something that probably should be highlighted. It's just, again, some snapshots of some of the stuff that we see from our overdoses. Again, the blue wax fold is, 90% of the drug overdoses comes from Philadelphia, but this is typical what we're seeing on overdose scenes. That's your blue bag. Usually, sometimes it has labels, sometimes it doesn't. That caused a fatal overdose in 2018. Again, some of the other stuff that we see from scenes, some of the drugs that the drug task force is seizing. The capsules on the right, that's typical what you see out of Baltimore. We get some of it. Street name, a lot of times a scramble, but it's a mixture of usually heroin and fentanyl and whatever else they can put into it. Just some search warrants, photos recently. Again, very uncommon. Heroin bundles from Philadelphia with an epinephrine pin next to it. So someone had a medical condition, but they're also using heroin. And again, some Cecil County drug raids. This is a very recent, just a couple of weeks ago. That is straight uncut heroin that was seized right here in Elkton on a drug task force raid. Usually they'll take that bag, break it down into the small ones, and distribute it. I also work, part of what I do in the task force is we get information about a drug dealer in Elkton or wherever else. We'll work very hard with other units, their patrol or their street crimes unit, to help them put together a case to go out there and make a seizure and get the drugs off the street. So again, it's interagency cooperation. We do that every day, and it's making a difference. We're getting some drugs off the street. Guns, drugs go hand in hand. Another seizure that Elkton did that got the guns and drugs off the street. A little bit about, again, I think you guys know my role. I have various roles working with public health, investigative support with law enforcement, and all that good stuff. So, public speaking. One of the things I know that I'm pretty proud of has been working with some of the agencies in the county, public health, law enforcement, health departments, and we've been able to, with some of my help and a lot of other help from people, over $2 million in grants collectively over just last year for certain programs like the child trauma to the health department. So it's been very good on that end. I always like to show these pictures because this is why I'm out here doing it. These girls are proof. They turned their lives around, and now they're out there making the numbers go down, saving lives. Can't say enough good about those two and many others. And again, another girl that approached me off the street, barely recognized her, but she came out and thanked us for doing what we do. So again, I always like to show that for those in the crowd. Rewrite Your Script has all the resources you need. If you have someone that needs help, Rewrite Your Script right there will get you where you need to go. So any questions, and did I miss anything?
No, it's a lot of information, but the unreported numbers of ODs that you talked about, I know it's hard to put a number to those. The best guess
My best guess would be double what I showed you up there. I mean, it's so hard to figure that out,
So we're talking about 1,250 to 1,300.
probably.
Okay. And where does your best intel from that information usually come from?
Family members and other, some of the actual overdose victims. I mean, it's not uncommon to, I've had people come and tell me, man, I've overdosed 12 times. The task force, there's been some raids and investigations where they've went into the house, and I've seen this firsthand. On walls, some of the users will actually have a place that they hang the Narcan on the wall, and it'll say Narcan use. I mean, so they have it hanging in their house in case they need it. Yeah, so I mean, it's everywhere. It's definitely, our fatals are way low. If we didn't have that Narcan out there, it would be dramatic, I believe.
Yep. Mr. Lynn, what are you seeing as far as the homeless population? I mean, that's a tough group to be able to get a handle on in terms of the amount of overdoses, but are you seeing that the statistics that you're having here, we're looking, I mean, obviously some of those folks are homeless, but, obviously in Elkton, at one point, there was a large homeless population, and how much is that contributing to some of the
And I do have the numbers for that, I just didn't have it on there. I do keep track of homeless. I don't, probably somewhere around 10 or 15% of the overdoses last year were probably homeless. We still have overdoses going on in some of the homeless camps. It did die off for a little bit when they cleared a lot of them out, but they're still out there. We've had some fatals associated with the homeless. That still gets referred to the health department, and I know they work with the various homeless agencies out here to go out there and walk the camps and find them. There was a, Fox News, I don't know if you guys saw it or not, I sent it out to a few people. Fox News this past weekend had a news video about an overdose death that occurred here in Cecil County, directly behind the rural farms at 213 and 40. That gentleman, we had dealt with him. Health department reached out to him. It's tough. He was living in the woods or living in different areas. No real fixed income, no fixed address. He was from the Rehoboth Beach, Lewis area. And he'd overdosed at least 1 or 2 times and had been present in some other overdoses. But he died, he overdosed in the woods by himself. In fact, it was really sad because when he died, there was a name mix-up. And we had a different name for him, and it took a day or two to really identify who he was and get the family notified. But it's still a problem. It's happening, but we're working to fix it. So.
Yeah, it's a tough situation, not only to monitor it and get accurate data, but also how to reach out to be able to make sure that programs are available to help the situation and working with law enforcement.
And again, directly with the law enforcement, they're not a forgotten group. I assure you, we're out there reaching out to them just like anybody else, and that's why I keep track of it. And homeless problem is just another one of those problems or issues that are associated with the drug use. Homeless, disease, prostitution. I try to keep track of some of the women involved with prostitution and overdoses. Again, we refer to the health department. That's a sensitive thing, but we're working with certain programs to reach out to them to get them into treatment and recovery, and deal with some of their health issues as well.
Yeah, and I saw you drew a pretty good comparison. At least you had the mental health issues that are associated with it too, and that also goes along with some homelessness.
Absolutely. And again, we talk about that quite a bit. Mental health versus drug, it goes hand in hand a lot of times. Another issue that is not really often, it's overlooked, but it is a problem, is the suicides associated with overdoses. And I try to keep track of that as well. There are people out there that hit rock bottom and they think there's nowhere else to turn to, and they use heroin as a form of overdose. And we try to keep track of that, reach out to families, and figure out how we can correct that, or at least prevent it or reduce it. So there's a lot of things that we're looking at more than just overdoses.
Thank you.
Ray, one more thing. With the Narcan, what is the cost of Narcan, and who supplies it to the families? Who actually foots that bill?
Sir, I'll refer that to Mike because I don't have information on how much it costs. And most of the health department will, most of it's grant funded. It's obtained through grant funding, but I don't have a unit dose price for that.
Okay.
So good morning. Like Lori said, I'm Mike Masuli, Deputy Director of the Alcohol and Drug Recovery Center at the Health Department, and I'll apologize. Right off the bat, my voice is starting to go, so I'll try to get through this. The availability of Narcan has grown tremendously over the last several years, and there's a few things that drive that. But in Cecil County, folks can get Narcan directly from the Health Department. We do a program where we offer pretty frequent no-charge training to folks in the community, where at the end of that training, they walk out with 2 doses of Narcan, as well as an overdose response kit. But more importantly, or just as important, we pack that training with a lot of information about addiction, about recovery, about local resources, because we want there to be more than just that life-saving intervention. We want that to be the opportunity for that family, that individual, to start to turn the corner toward recovery. Narcan, the price that we're able to get it for is 2 doses for $75. But no longer in the state of Maryland does somebody need to go through a training like ours to get Narcan. There's a statewide standing order. Anybody in Maryland can go into any pharmacy, ask for and receive Narcan without a prescription. Most insurances cover it with a copay. A lot of the folks that we serve are Medicaid recipients. The copay is, I think, $1, it might be $3. A lot of commercial insurers, it's a $25 copay.
Okay.
That answered?
Yeah, yes, it does. Council, do you have any more questions on that?
Hundreds, but
Okay, Ray, thank you very much for your presentation. Appreciate it.
Thank you.
thank you, Rick.
Okay, and not to end the health department section on a negative note about all the people that are overdosing, we want to share with you something we're doing about it. We're not sitting on our hands just being reactive to the overdoses that are happening. We've got a very robust youth prevention program that is in place, and we want to share some information about that program with you. So I'm going to ask Beth Creek from Youth Empowerment Source and Virgil Boysaw from the Health Department to come and share with you some of the work that they're doing. And I
Well, good morning.
Good morning.
We
Morning.
want to first thank you for allowing us to share the information we have. A lot of good things are happening here in Cecil County, and I want to thank all the partners that we partner with and collaborate with to bring in the youth engagement portion. What we deal with is the Drug-Free Community Coalition. But the idea of the Drug-Free Community Coalition really is really 2 major goals. Number one, we look to increase collaboration, and number 2, we seek to reduce substance abuse among our youth. So our main goal really, while our partners in treatment, partners in recovery support, partners in public safety are doing what they can really to decrease the substance abuse areas, we are looking at taking away that pipeline so that more youth are not going into the treatment area. So the whole idea of the Drug-Free Cecil is really a multi-coalition approach to dealing with this challenge. One thing about Cecil County I've found is that we're not short in terms of people wanting to come together to collaborate. So one thing we try to do is connect. We try to leverage our resources so we can reduce duplication of efforts. We also look to inspire one another and encourage one another in our efforts. One thing we always say about Drug-Free Cecil is it's not a brand, but it's really the ultimate prevention collaboration. Now, basically, there's about 4 pillars, and I'm going to go with this very quickly. I know our time is short, but there's prevention, there's treatment, there's recovery support, and there's public safety. And all of us really hold up the house that actually guide everything for us. We know a house divided cannot stand. So with that, we look to seek to collaborate to see where our strategic plans actually intersect. So on the prevention side, we have several coalitions here in this county that are doing fine work. So again, so that what we did, we took the initiative to look at each of these coalitions' strategic plan to see exactly where their plan intersect with our plan. So you have the Drug-Free Cecil Coalition, You have the opioid misuse prevention project. You have the Maryland Strategic Prevention Framework 2. You have the block grant as well as the tobacco task force. We all come together to actually collaborate and see where we can work together. But in that, we know that the ultimate thing that we have to have at the table is have our youth really part of the conversation. So we look at looking at what we all do, come together, collaborate. So I'm going to pass it off to Ms. Beth here, who also deals with the youth engagement part, and she can show you exactly where this is going.
So thank you for having us. And I want to thank Lori Humphreys, our acting health department, for being a prevention champion. You might notice that this says CADCA at the top. That's the Community Anti-Drug Coalitions of America. And Virgil and I were privileged to present nationally to them in earlier this month on this very thing, because we have something unique in Cecil County, and Drug-Free Cecil essentially is that collaboration of all of the substance use prevention directed at youth, all of the different coalitions working together. And as he said, we look at their strategic plans to see where they intersect. And you can see up there the different, each grant has different substances that it's responsible for addressing. And so we try to see where we can leverage those resources and how we can reduce youth from becoming substance involved. So multi-coalition work has allowed us to do some pretty amazing things in Cecil County, and sometimes I think we don't blow our own horn quite enough about it. It's allowed us to reduce duplication of services. So it allows us to eliminate redundancy and leverage the resources that each one of us has. It's allowed us to achieve policy change. Last year, we brought, well, 2 years now almost, year and a half, we brought before you the alcohol policy change for responsible beverage service training, and that passed last spring in Annapolis and took effect last July. Prior to that change, only one licensee per alcohol establishment had to have responsible beverage service training. Following that change, now every bartender, manager, or anyone in a position of authority has to have it. So we have had over 700 people trained in the past year in responsible beverage service training. Compare that to less than 80 on an average year prior to the change. Now we're talking about more than 600 people who are out there handling alcohol, who are now informed about how to spot a fraudulent ID, how to note when someone is being overserved, but particularly to really reduce those underage drinkers. So that was pretty significant. And last Friday, I actually was invited to testify in Annapolis because there was a bill pending that is seeking to have the state change to an RBS policy that would mirror the Cecil County policy. And they asked us to send someone down there because they said, this is the pioneering policy that needs to be in place statewide. So they are looking at what we're doing in some of these areas. Drug-Free Cecil allows us to provide leadership training for our youth. We have taken youth to the National Forum, the CADCA National Forum, the CADCA Mid-Year Forum, and this year, because of the health department's generosity, they allowed us to, they gave us access to some funds so that we could take 9 youth from Cecil County to a week-long training and an opportunity for them to speak on Capitol Hill to their legislators about the situations happening in Cecil County and what they want to do about it. They have their own ideas about solutions, and we need to listen to them because it's their peers. And honestly, some of the young people that we took with us, it's them. They have been affected by this in dramatic ways. We have at least one young person in the group who shared that she had a parent who had struggled with substance use. Actually, we have several who have struggled with substance abuse. One who had been repeatedly incarcerated. The impact on her and her family has been significant, and she shared that with our legislators. It was very powerful. But that National Forum also provided tremendous training for them. We know that young people begin these risk-taking behaviors in about the 5th or 6th grade. So 10, 11, 12-year-olds are the ones who begin, and they begin with what's in the medicine cabinet. They start statistically with things like cough syrup. And so over-the-counter medication safety training was offered, and we have an entire group of young people now who are certified trainers, and we are going to be in cooperation with our great partners at North Bay and Cecil County Public Schools. Next year, when those sixth graders all go to North Bay, every one of them is going to receive over-the-counter medication safety training, which really opens their eyes to the dangers and hopefully will slow down the onset of some of these risk-taking behaviors that we see. So it's allowed us to hold successful community events. Some of you may remember we had the White House, HIDA, DEA up here a year and a half ago for a big drug take-back event that we did. That was phenomenally successful. 1,500 people were there that day, and it was really an amazing day that our friends in Washington still talk to us about when they see us. Most recently, this cooperation has allowed us to develop a youth coalition. This is a youth-led, adult-guided initiative. In the summer of 2018, Virgil and I were in Orlando with two of our youth, and they were taking the mid-year CADCA training. While we were there, they came to us and they said, we need a youth coalition in Cecil County. We have all these adult coalitions about substance abuse, but we need a youth coalition. And they were adamant about it. So I did the only thing I knew how to do. I came back and I wrote a grant because that's what I do. And so Governor's Office of Crime Control and Prevention has funded about $20,000 for our youth in Cecil County this year to receive additional training. And the MSPIF 2 Coalition has allowed us to have some funding for a part-time youth coalition advisor. She is a YES employee and she just dedicates about 20 hours a month to youth coalition work. But these youth represent all county high schools, including School of Tech. They come together on a monthly basis at our office, and they meet and they talk about what they want to do and what solutions they are proposing. It's pretty powerful. I would say if we had an ask for you today, it would be that you would put May 11th on your calendar if you're not already booked, because the youth are planning a countywide prevention rally, and it will be held at Cecil College. You'll be getting more details in a letter next week that will be coming to you, but the youth are finishing that letter right now. So there's a lot for you to be very proud of that's happening in Cecil County regarding our young people. It's this collaboration has allowed us to distribute over 25,000 deterrent drug deactivation kits with our partner at Rally, allowed us to host an annual youth leadership summit at North Bay Adventure Camp. All 6 high schools are represented. You've probably seen last year's PSAs out on Comcast and the billboards that are up and down Route 40 and 213. There are new PSAs coming that were developed this past November. Every high school took a different substance and they wrote, directed, and starred in their own PSAs. They are powerful, and I've seen them. I can't wait for you all to see them. This is a picture of our Youth Leadership Summit from 2018-19, and really this was a partnership that started between North Bay and the school system. Ken Collins from the health department was instrumental in getting that off the ground several years ago, and then when Virgil came along, it really began to take shape as something where the youth could really focus on prevention and what they want to do in their community to make this a safer and healthier Cecil County. This is one of the examples of one of the billboards that they created. So the big picture of multi-coalition work has allowed us to leverage, unify, and sustain, but most importantly, it's allowed us to make impactful inroads with the young people that live and play in Cecil County. And I will tell you that the state is looking at this. We not only presented nationally at CADCA, but Virgil and I are presenting to a group of coalitions from throughout the state. Behavioral Health Administration has requested we come and do a presentation for them at the end of March, because they think that this model could be used in other communities to leverage resources and get more work done. So that's where we're headed. Questions?
Council, do you have any questions?
I just have one, and that you do currently offer a program through CCPS, correct?
CCPS offers the Life Skills Program.
That's correct, and I believe that's for what, fifth graders?
That starts, I believe, at 3rd grade.
Okay.
All the way up through high school.
And then now we're including it, now we're going to incorporate North Bay as part of that program, where we know basically all 6th graders in the county will be there for that week long, and then they'll also get this additional training.
So YES is doing that in cooperation with CCPS. We've met with not only Dr. Lawson, but also with John Roush, the head of student safety, and they've signed off on us bringing the youth trainers in to train the younger kids in over-the-counter medication safety.
That's great.
May I add to that too? One thing we do have here is that we have corporate partners as well. So Johnson & Johnson is actually partnering with our coalition to help make that happen. So again, not that we only have local partnerships, but we have state partnerships, we have federal partnerships. We're looking at increasing our corporate partnerships, so we bring even more attention to what we're doing here in Cecil County.
Well, Beth and Virgil, I want to thank you both for what you do. I belong to a lot of your committees, and I know the hard work you do. And also in the back, Dr. Lawson, thank you very much for allowing this into the public school system. We truly are. Hats off to you. Thank you.
Thank you.
I do have one more question. First of all, I want to thank you. We've moved a lot. We've moved very much forward in the last couple of years. You guys have done a great job, and I appreciate all you're doing for our youth and trying to prevent this as we move forward. I was wondering if you do any kind of coordination or if there's plans for the future with MRDC, since they have a lot of work they do in like Hollingsworth Manor. And, you know, there's certain areas in our community which are more hotbeds for drug use where kids are growing up and being exposed to this all the time.
Thank you for bringing that part up there. Yes, when we talk about collaboration, we also collaborate with the local management board, who is really leading that effort over in Hollingsworth Manor. We're looking at it as a template for the other communities that would like to work in. This coalition is only a little bit over 4 years old. So this is just the tip of the iceberg. We have so much we want to do. So as Beth stated earlier about our ask, we just ask for your support because we have so many ideas, especially with the youth. The youth have ideas, and we definitely start working with the local management board in Hollingsworth Manor just to do such things as that.
Yeah, thank you. I just really appreciate that you're getting the youth to take responsibility and take control of this situation because it's their generation that is dealing with us. So appreciate that.
Thank you. Thank you.
Some more? You're good? Sheriff Adams, do you have anything?
You got about 3 hours. I'll be quick because it has been 47 minutes here that we've been talking about this, and I know a lot of people are frustrated with this problem that seems to continue. So you hear all the great things we're doing in Cecil County and nationwide. We're trying to learn best practices that everybody else is doing, try to figure out how we can reduce this because you hear our numbers are still going up. Right? I mean, overall overdoses are still increasing, even though we're doing all this programming. So why is that? So I have some pretty strong opinions on that. A major problem that we're seeing is the legalization trending towards marijuana. Also, vaping and Juuls, if you know anything about in the high schools and middle schools, they're getting very popular. So what this does is, as Ray said, our average overdose patient was, 28 to 35. So we're not hearing a lot of young kids overdosing, because they're not starting with heroin, they're starting with one of these other substances I just brought up. So we've really got to wrap our heads around and get some change going on that going forward. We cannot continue to say that this is a terrible opioid epidemic that we're in. However, we're legalizing these other drugs on the other side of things, these gateway drugs that kids are starting with. That's what leads down the road. You know, we talk about prevention, and we also have the DARE program in the schools. We continue, so we do hit all sixth graders with that. Mr. Patch we have for years. So yes, we've got to continue this programming, but we've got to look at the front line, and you know, it usually comes down to money. Who's making money off of these different products? And so when we lower inhibitions of kids, somebody decides today that I'm going to smoke a cigarette, you just lowered inhibitions for tomorrow for them to use a different kind of drug. So once you do one, it's easier to do a harder drug or something different as you go down the line. So we've really got to look at legislation and going forward and not being okay with this being shoved down our throat. That we have seen a huge uptick in marijuana citations. So now marijuana under 10 grams in the state is a civil citation. It's not criminal anymore. So every day when I read our sheriff's reports that come in, we have several marijuana citation under 10 grams, marijuana under 10 grams. So it's like common, it's very common out there. So it's almost accepted. It is accepted, I would say. So that's a problem going forward. I think we really have to look at some of the underlying reasons still. Why are we still seeing all these overdoses? Why are people using drugs? Why are they starting drugs? And I think I just hit some of that. And we have to keep going to the prevention side, doing everything that we're doing, continuing down that path with the people that want help. It's got to be available. And I think we've made great strides, right, in that, where we didn't used to have those programs. People would complain they couldn't get into programming when they want it. I think we've made great strides in that area where programming is available when they want it. We have to continue to have that available for when they need it, it's there. But it's still frustrating. I think we always want, we want to solve this, tomorrow. And we've talked about this for 4 years. And I said 4 years ago, it's not going to be solved tomorrow. This is a long-term dig out that we're going to have to start addressing. And we've hit a lot of things. I think we're doing a lot of great things, but we can't stop doing that. We also have to, we on the law enforcement side of things, we crush this. We continue to hit this hard, and I'll do an annual report here soon from 2018. You'll see that our drug arrests were up. We continue to make big arrests, and reference some task force arrests we just made, but that's continually. Every week we're making big arrests through our task force, our street crimes units. We're getting intel. We're moving that up. But our judicial system has got to follow through on after those arrests and make drug dealers know you are not welcome in Cecil County. We cannot have drug dealers move in out of these other areas because it's better business in Cecil County because there's customers here and it's safer for them on the streets here. So we can't have that message here. They've got to be not welcome. Question. That's some of my quick 5-minute opinion.
Council, do you have questions?
With pending legislation out there for legalization of recreational marijuana, I mean, that has to play into the exact dialogue you were just talking about.
Exactly. I think that'll be a huge mistake. I don't know what we can do about it. From everywhere else I've seen marijuana become legalized in states it wasn't legislated in, it was through referendum. And that's probably the route Maryland will end up going. I just think it's a big mistake. There's a lot of money involved.
How involved is the medical marijuana portion of this?
I've heard both sides of medical marijuana, but my gut kind of leads, I guess there's some good that can come from medical marijuana. I heard the American Addiction Society of, I'm going to get this all messed up. There's a physicians group Physicians Group of Addicted Medicines or something, is anti even medical marijuana now because they've seen some, they've got some problems with the way it's dispensed and it's not regulated whatsoever through doctors. Which is, no doctor is going to say that's a good thing. And I also think it's just a foothold in the door to push it to the legalization, the recreational side, because that's where they're going to make more money.
Are you noticing with decriminalization that there's more people that are willing to just be more open with having it? Is that why you're finding more of an uptick in that?
I would say yes.
Okay.
I think that's why we're seeing so many more citations out there where people, it's almost accepted behavior. It's not criminal anymore. So, and then we run into the issues with driving while impaired, and there's all kinds of issues with that they're trying to sort through.
There was an article recently about the driving while impaired under the influence of marijuana. I'm guessing that we still don't have an effective way of testing for that.
We do not. There's a lot of information out. If you Google that, you'll see in some of Colorado, some of the states that have legalized some of the issues they're having with that, and there is not a good test yet to show that.
Council, have any questions? Any more? Well, Sheriff Adams, thank you for your report. And I want to thank Laura. I want to thank you for everybody you brought forward this morning. I think, I hope that people in this room really got an insight as to what's going on. A lot of times we preach to the same choir. So everybody says, okay, fine, we're going to do something about it, but it doesn't really affect them. Now I think everybody in this room would say somebody, either a friend, a neighbor, a relative, has had a problem. So it's become more apparent now. So I think you know, when we have these discussions, when we have these kind of panels, I think it does a lot to help bring something home. So again, I would thank you very much, and we do this again next year, maybe the numbers will be down. Ray, that's your job. Thank you very much, all of you.
Thank you.
Okay, now we move into the presentation for the water service expansion, Town of Rising Sun. Okay.
Council, if you can give us about maybe 3 minutes while we
Sure.
prepare this up.
Not a
In the
problem.
meantime, I did
Ahead of
want to
your
say
time,
Not
a
a
huge
problem at
thank
all.
you to all the community leaders that came out, as well as Commissioner Pearson and Commissioner Braun. Two of our commissioners are actually out of town, or they would have been here as well. So a big thank you to them for coming out.
Okay. Well, first of all, we would like to welcome Rising Sun's Mayor Travis Marion and Calvin, the town administrator, and they'll be providing the proposal for the water service expansion.
Ladies and gentlemen, on behalf of the Rising Sun Board of Commissioners and the Town of Rising Sun, I want to personally thank the County Council for allowing us to make this presentation today. We are excited about the prospects of what lies ahead for Rising Sun, and as always, we are grateful for the support of County Council. Our focus today is to cover 5 objects and goals. As you can well appreciate, hold on, we're having some technical difficulties. All right, objects and goals of today's presentation. As you are well aware, the town has been under a growth moratorium, and as a result of inadequate water supply and a failing wastewater treatment plant, today's presentation is a culmination of several years of commitment put forth by the Town of Rising Sun, and with the support and help from both past and present members of the County Council. As you can well appreciate, water and sewer resources are a vital component needed for economic development, but more importantly, maintaining a financially sustainable community cannot happen without these resources. Water and sewer is the engine that drives economic development, and without them, communities like Rising Sun will suffer immensely. The county and other towns of Cecil County have made significant financial investments in these utilities and have begun to realize the payback of these efforts through increased revenues, jobs, housing, prosperity, and economic opportunities for the citizens of Cecil County. The investments in water and sewer infrastructure along the Route 40 and 95 corridors are prime examples of how pulling resources and working together can yield significant financial benefits to not only the county, but to the towns of Elkton, Northeast, Charlestown, and Perryville. The county's Office of Economic Development is to be commended for their efforts at promoting economic development for the county. They have truly championed the opportunities that Cecil County has to offer. However, the county's success stories are not just isolated to the 40 and 95 corridor. Other large investments have been made just beyond the town of Rising Sun and are projected to offer significant economic benefits and opportunities to Cecil County and the region. In 2015, then County Executive Terry Moore touted the park, which is Calvert Regional Park. She went on to say and state, the park specifically, it is a part of our economic development, she said. It will bring to Cecil County, people to Cecil County to stay for a while they are here. The visitors will stay in our hotels, eat in our restaurants, and shop in our stores. In 2017, this annual event was lauded as having huge economic impacts for the county, which is the 4-star equestrian competition in Fair Hill. County and state officials praised the benefits to the county. All right, bear with me, we're having one more technical difficulty.
had this topical discussion, opposed to what we did, how we want to act.
All right. So the county announced that the Fairhill International had been selected to host the very prestigious four-star equestrian competition. This annual event was lauded as having a huge impact on Cecil County. County and state officials praised the benefits to the county, stating, over time, it's going to grow to be something equivalent to another Preakness, which will be huge for Cecil County. They further stated that other four-star events ranging from 15 million to 30 million economic impact. They further cited attendance ranges from 80,000 to 160,000 people at other four-star events around the world. As mayor, I have 3 questions that will hopefully be answered later. Despite our long journey, when referencing and celebrating economic opportunities for the county, does the county consider Rising Sun as a possible beneficiary? When citing $15 to $30 million in impacts to the county and region around Fairhill, does the county consider Rising Sun as a possible recipient? When citing the need for hotels and accommodations for the thousands of people that will be in the northern region of Cecil County, does the county consider Rising Sun as a partner in that development? Despite our long journey to get here and the obstacles that we have had to overcome, this presentation today is about Rising Sun positioning itself to carve out our portion of the economic prosperity and opportunities that other towns of Cecil County are enjoying. We are not looking for money, favors, or special dispensation. Furthermore, our presentation should not come as a surprise to anyone because it is consistent with the plans that we have submitted to the county staff, county council, county planning commission, and the county executive all since 2016. In fact, this will be our 8th meeting or interaction with county government regarding our plans and efforts. Although we previously received great support across the board from the county, and despite no changes in our plans, the county is now applying roadblocks and other obstacles that in reality have not been applied to other towns of Cecil County. Furthermore, we have recently been told that the county did not know the extent of our plans or our intentions when we came before counties in the past. There have been a suggestion that the county did not know we were securing 1 million gallons per day of water, or that we had any intentions of serving that water beyond the incorporated limits of Rising Sun. I'm not sure how this is possible. The town was required to secure approval from the Susquehanna River Basin Commission. The application packet was required to be submitted to the county for review back in 2016. That packet included a summary letter that stated in part, the Chester Water Authority and the town of Rising Sun filed an application for the Susquehanna River Basin Commission for a withdrawal via an interconnection and to supply bulk water of up to 1.8 million gallons per day. In that letter, I formally requested a meeting to discuss the framework of the partnership that would enable the extension of town water and sewer utilities beyond town limits. I emphasized that the town will have 1 million gallons per day capacity and that the town should be considered a major player in the areas surrounding the town of Rising Sun. I further stated that it is very encouraging to see the county taking a leadership role in the economic development throughout the county and has clearly staked its ground in investment and economic opportunity in the surrounding Calvert and Fairhill regions. In addition, the newly constructed Calvert Regional Park, the prospects of the 4-star equestrian event coming to Fairhill in 2019 are projected to generate upwards of $20 to $30 million of economic impact to the county. One would assume that part of this vision is the creation and establishment of a stable business environment, consistent, numerous ancillary businesses such as hotels, restaurants, banks, tourism, and complementary venues that require a skilled workforce that in turn can attract other prosperous enterprises with even greater positive economic impacts to the county. I cautioned that the real benefactor to these opportunities could actually be Newark, Delaware, just a few minutes from the region, which already has a significant head start in reaping the benefits due to the establishment of a business community, infrastructure, and available workforce. I reminded Dr. McCarthy that critical infrastructure to the region is ready and available to jumpstart this vision and expedite the returns on these investments. I also emphasized that the town already had realistic prospects of expanding the services in and around the Rising Sun region and to begin construction within the next 12 to 16 months. I briefed him on our conversations with representatives from Southern States, Calvert Manor Nursing Home, Ramsey Ford, as well as with representatives from the Cecil County School District. All parties have expressed a desire to pursue the feasibility of water and sewer connections to the town of Rising Sun and are anxious to meet with the town and county to move this initiative forward. County Council, despite what you have allegedly heard, these plans have been discussed with county representatives. They are not made up stories or lies put forth by myself, staff of the town of Rising Sun. You will see later in this presentation that we have received multiple inquiries from the property owners throughout the region that are interested in the town's water and sewer. Some of those owners and representatives are here today in the audience. Furthermore, the town of Rising Sun has supported numerous efforts and initiatives put forth by the county over the years. We have been an active cheerleader for these initiatives, but somehow, despite our impression that we have a wonderful relationship with our county government, we have recently heard some very troubling comments being made about our community by officials of the county. We've been approached by several of our partners that the county is now interjecting itself in our affairs in a manner that is very troubling. Going forward, and the reason for us being here today is that we are hopeful and optimistic that these are misunderstandings and confusion about the town, about what the town is hoping to achieve, and not the true intention of the county. Because as you will see in this presentation, the unintended consequences of repeating history, interfering with the town's ability to realize its potential, will be devastating to the town. We are here today to put both challenges, we are here today to both challenge and dispel those comments and to put to rest those misleading rumors and misinformation about our plans, our intentions, and the impacts of the northern regions of Cecil County. Ladies and gentlemen, we are at a watershed moment for the town of Rising Sun. Speaking on behalf of the Board of Commissioners, we cannot do anything short of the absolute best for our community. I again thank you for the time and indulgence on this very important matter. I will turn the presentation over to our town administrator to handle the aspects of our town. And again, I am happy to say that Rising Sun is finally open for business.
Council, we are obviously having some glitches in the timing of our presentation, so we're sort of winging it a little bit here also. I think that the mayor emphasized how important it is for us being here today. And I think that it's very important that you understand the journey that the town has taken over the years and why we are so desperate to have our voice heard here. We've invested a lot of time and money in this, and to hit a wall now will be devastating to the town of Rising Sun. So we are here before you today as a community that has worked very hard to overcome significant obstacles, suppressed economic opportunities, and limited resources in which to draw upon to provide for our residents. As the mayor implied in his opening remarks, if the town is not permitted or hindered in its efforts to utilize the resources of its water and sewer capacity, the end result will be the same as putting the moratorium back in place. In order to understand this better, we must first answer the question of how did we get here? Furthermore, the town found itself not having enough water to supply the development demands that were knocking on the door of Rising Sun. We've had, starting back in the early 2000s, the town of Rising Sun, in late 1990s, early 2000s, the town of Rising Sun started having significant water shortages in town that resulted in us having to use tanker relays from the fire company to bring water in, to put drought restrictions on our residents, to spend enormous amounts of money doing studies to try to figure out how to resolve this issue. Equally troubling at that time was the town's antiquated sewer plant that was unable to properly treat and clean the town's wastewater to acceptable levels or environmental standards as required by state and federal law. As a result, the town was issued a consent order in 2006 and was further directed by the courts to bring its wastewater plant into compliance. The mayor and commissioners in office at that time were also experiencing significant development interest and pressure. Developers were excited by the town's 2005 comprehensive plan growth area map that was calling for growth north, east, south, and west of the town of Rising Sun. I think it's important to note that that image that you see there, you're going to see that reoccurring image come up in both county documents and town documents going forward. That is what people in the town of Rising Sun in the early 2000s were under the impression that they could develop those areas. That was the town's growth area in its 2005 comprehensive plan. However, with the problems with the wastewater treatment plant and the shortage of water, the elected body recognized that any more new homes, businesses, and connections to the system would simply exacerbate an already inadequate water distribution and failing wastewater treatment system, and took the painful steps in 2006 to declare and institute a building moratorium on new construction. Over the next decade, as other towns were experiencing the benefits of economic development, growth, and prosperity, the town of Rising Sun struggled to navigate its way through numerous financial challenges and obstacles in its efforts to solve the water and wastewater issues. Ever-changing environmental regulations created a moving target, as the expected cost for upgrades, originally projected to be around $10 million, ended up exceeding $25 million. After several years of no building or economic development in the town, the negative impacts on the community were self-evident. As a result of the moratorium, there was a prohibition against any new construction, and investments in the community became stagnant and all but dried up. In 2016, the town's real estate values had plummeted roughly 33% since 2010, leaving the town with the lowest assessed property value per person in the county or in incorporated towns. So essentially what that is saying is when you take the population of Rising Sun, in 2016, it being roughly 2871, and took the total assessed value of land in the town of Rising Sun, that only came out to a value of $64,736,000 per person, compared to the towns of Port Deposit, Elkton, Northeast, which are higher. Despite these obstacles, the town still managed to maintain the second lowest tax rate per person at $310 per year, despite providing both police and code enforcement services to our residents. So essentially what we're saying here is that the town did not raise taxes during that time. It kept the real estate tax rate the way it was, even though the real estate values were declining. We couldn't turn around and raise taxes on residents that were seeing their means for economic success declining around them also. So what this is showing is that of the 2,871 people and the amount of tax revenue that is generated, that meant that each person in the town of Rising Sun was only paying $310.74 per person to provide all the normal services that you get in a municipality, but also in addition a fully staffed police department and to perform our own code enforcement. So you can see the town was operating very economically during that time. Although these challenges proved to be monumental, the resolve and perseverance of the community proved to be equal to the challenges, and after several years of hope followed by years of disappointment, Rising Sun was able to commission a new state-of-the-art wastewater treatment facility in August of 2015. At a cost of $16 million, our community of 2,800 residents and 900 properties was not finished. The challenges were only halfway met. Still facing the town was how to get water. The town commissioned studies that concluded that purchasing land, searching for wells, and installing the required infrastructure would cost roughly $38 million. And let me stop and say the reason behind that is if you consider the town of Rising Sun being a bowl of water, MDE was not going to allow us to put any more straws into that bowl of water because it would have a negative impact on any wells in the area, because that bowl of water not only covered the town of Rising Sun, but areas beyond the town of Rising Sun. So the enormous cost associated with this was related to us having to basically go to another bowl of water or another basin, purchase land, drill for wells, hope you hit water, hope you get enough water for what you need, and then to pipe all of that back to the town of Rising Sun. So that has a lot to do with the enormous costs that were expected at that time. The town also met with the towns of Perryville, Northeast, and Port Deposit, but no one was in a position to provide us water without a tremendous amount of upfront costs, pump stations, and additional water towers. As you can imagine, those communities are all lower towards the water basins, the river, so forth and so on. So getting water to us would require pump stations in order to get it back up to our area. The town met with Chester Water Authority, and after 3 long years of negotiations and discussions, came to an agreement for the purchase of up to 1 million gallons per day of water. The total cost of the project was estimated to be roughly $10.5 million. The project consisted of a 5-mile transmission line extending out of Pennsylvania, crossing the state line in northern Cecil County. After many years of securing approvals from various federal and state agencies to include presentations before this council and the County Planning Commission, the town broke ground on the construction of the Chester Water Town of Rising Sun Interconnect project on May 2nd, 2018. It was a momentous occasion that was shared by all. We were so grateful for the county and state officials that came out to celebrate this day. The Secretary of MDE was also in attendance. He had been a fierce advocate for this project, and he personally sponsored the project at the Susquehanna River Basin Commission hearings held in 2017. He spoke at the groundbreaking, stating, "This is almost like a graduation ceremony. You have all been studying so hard." Secretary of Maryland Department of the Environment Ben Grumble said. He went on to further speak of the importance of the project, that it will provide up to 1 million gallons of water per day to the western Cecil County towns. Water is life and transcends boundaries, he added. Where it flows, it grows. Grumble said that the work at so many levels of county, state, and federal government, which involved 2 states, was impressive. It's a great example for other regions around the country. With this monumental task behind us and the town facing $26 million of total infrastructure financing, the town lifted the moratorium in the fall of 2018. And as the mayor said previously, Rising Sun was open for business. The next part of our presentation is going to combine goals 2, 3, and 4. In order to do this, we are going to switch over to Google Earth to complete. We are going to summarize the town's position. So we had a problem with the PowerPoint here. Goals 2, 3, and 4 are about introducing to you our comprehensive plan amendments, our comments on the county's master sewer and water plan, and to also dispel some misconceptions about what the town's intent is regarding the northern region of Cecil County. More particularly, we're going to talk about how the town of Rising Sun is not looking to change the rural character of northern Cecil County. We are not looking to, or requesting any changes to the rural legacy program. We want to bring out some anomalies we think exist with the Cecil County Preservation District and how that is significantly binding the town of Rising Sun. And we also want to make sure that we're addressing this fear that where there is water and sewer that you sell, that automatically you're looking to develop to, let's use an example of Whitemarsh or Bel Air or Havre de Grace. That is not what the town of Rising Sun is intending to do. We, like the county and others, respect the rights of farmers. We want to preserve that rural heritage of the farming community out in Cecil County. And we're only asking to be able to provide services to residents who would be able to utilize their land exactly the way the county zoning code already sets forth the utilization of that land. So if you give me 1 second, I'm going to switch over to the Google Earth. And hopefully this program, when we loaded this at the beginning, we did incur some problems there that seemed to correct themselves, so I'm optimistic that we won't have a problem. those that are not familiar, Google Earth is a wonderful GIS program that we have been utilizing to perform some mapping functions here. So when you look at the town of Rising Sun and what we're looking to do here, we need to address our comp plan and our master sewer and water plan amendment request to the county. So the first thing we're going to look at is our comp plan. And in looking at a comp plan, you need to address in the comp plan, we are required to show a municipal growth area and to submit that to the county, hopefully for incorporation in their comprehensive plan. So if I can get this to line up. So what you have here is the town of Rising Sun in the red, highlighted by the gray or colored in by the gray, is existing town of Rising Sun. In our comp plan amendment, we are looking to have a growth area that is defined by the green area here. You can see in the legend down here the municipal territory, and then the municipal growth area is defined by that green boundary. Then you must then look at the annexation, what the town of Rising Sun plans to do in these areas. So we have the growth area again and the town of Rising Sun. The top of this is the Pennsylvania line. For those that are not familiar, the town of Rising Sun is up in the northern quarter of Cecil County. This growth area would run right up to the state line of Pennsylvania. So in this growth area, we are looking to have annexation. And what we're showing here is the annexation that we are looking to have available to us in the future. And so again, you have the red area colored in by gray is the current town limits. The lightest color on the board here is phase 1 growth. The pinkish color is phase 2 growth, and the brownish color here is the phase 3 growth. So what you can see here is the town is looking in the first couple of years to grow in and around the areas adjacent to the town of Rising Sun. This is Pierce Road, 273, up the Route 1 corridor. These are the areas that we're looking to have growth in let's say, the next 2 to 3 years, 3 to 4 years. These areas out here, I highlighted in the orange type color, represent some water service requests that we have that we're going to elaborate on. And the fact that we would be looking to annex those areas. This location right here is the location of Southern States at Wilson Road and 273. For a better landmark, you might be familiar with Ramsey Ford at this location here. Now, let me back up and say that the reason why the annexation is important to residents or potential customers of the town of Rising Sun is that we are not the only community that is proposing to be providing water and sewer beyond our incorporated limits. The town of Northeast is a very good example of a community that provides water facilities beyond the town limits. And if you remember a couple of years ago, the county and Northeast were involved in a legal issue that resulted in a mediation board or a court instructing Northeast that they had to charge double the amount of water rates for people getting water beyond the incorporated limits of the town of Northeast because they are not annexed into the town. So if we are to provide water and sewer services to the customers that we're going to show you would like those services, it would be in their best interest to annex into the town of Rising Sun, because in reality, the additional town tax that they would pay would be cheaper than the out-of-town sewer and water rate that they would have to pay. So the important thing to emphasize is we're looking to do what other communities are doing, very similar, being the town town of Northeast in terms of being able to move this water beyond the town limits. The next area that we want to look at is the additional land use in terms of considering what we are going to do with our annexation plan. We also have to address the additional land uses. So when you look at the town's annexation plan, the town is going to be incorporating in our plans a lot of green belts and open space. And so when you look at these lands that are earmarked for annexation, it's important to note that the town in its comprehensive plan is going to be designating green belts and open space areas to help preserve the rural nature of Cecil County. So when you start to see the areas that are earmarked for annexation in the future, you can see we are talking about putting large swaths of area in actual green belt and our own version of land preservation. The other thing that's interesting when you look at our annexation plan is the town's 2005 comprehensive plan. The one I showed earlier, I told you to keep track of that image, and you can see in 2005, we're not looking to do annexation that much more significant than the areas that were designated for growth in the 2005 comp plan. In addition, if you look at the 2004 Cecil County urban plan, Cecil County in 2004 had called for annexation or growth all the way out to Silmar Lane on 273. So again, there are some similarities to what we are doing. In 1990, the county had an urban development plan that, although it is not necessarily referred to, back in 1990, there was talk about growth extending all the way down 276 into the area of the Hunter Sale Barn and West Nottingham Academy. And so one of the comments that has been made to us is that our plans are inconsistent with the county's vision going all the way back to, I believe it was 1962. We're just simply trying to say that just like in our comprehensive plan, ideas change. And so our plan is not that inconsistent with some of the ideas and concepts that the county had had in the past. So that is our comprehensive plan. Now we want to look at our water service areas. And this map represents the existing master water plan for the town of Rising Sun. You can see the gray area in here is the incorporated limits of the town of Rising Sun, and the color swath areas are where the county and our plan submitted to the county shows what we were looking to serve up to this point. However, the town has received a lot of requests for additional service areas. Predominantly, we're getting a lot of requests out towards the east up 273. And as I zoom into these a little bit closer, the areas that we have, the first one is Southern States, which is the pesticide company that allegedly contaminated the wells of 14 residential properties out on Wilson Road. They are under an environmental consent decree with MDE to fix that issue. And they have been in that consent decree since 2005. And they have had discussions with the town of Rising Sun going all the way back to 2010 about the possibility of us providing water to their land in the 14 houses. So that is a request that we have gotten. We've also gotten a request from Ramsey Ford and Steve Ramsey and Mark Hyman, who have approximately 19 acres of ground consisting of the Ford dealership and a 10-acre piece of ground directly across the street at the corner of Wilson and 273. They are looking to develop that land. And one point of interest is, as we talked about in our earlier presentation, the county has spent a lot of money in doing some upgrades to Calvert Regional Park. And previous county executive Terry Moore had talked about the ability to have ability to need upwards of 3,000 hotel rooms for travel teams that would be coming to Calvert Regional Park whenever there's an event. And basically the town of Rising Sun is saying, well, here's an ideal location of 10 acres of ground that is zoned BG that would be an ideal location for a hotel/restaurant to accommodate those travel teams who would be coming to Calvert Regional Park. So you have the landowner basically saying, hey, the best way for me to be able to utilize the value of that land is to get water and sewer from the town of Rising Sun. We've also received an inquiry from Plumpton Park Zoo, who has sent us a letter requesting consideration for water and sewer out at their location in the future. Not that it's anything that they are looking to do right at this moment, but they want to leave their options open so that, one, they can expand the features that they have out there, and it could also help them be able to care better for their animals out there with having water and sewer. We have also received, we've had a lot of discussions with the Cecil County Public Schools over the last couple of years regarding interest in having water and sewer delivered to the Calvert Elementary School and the Rising Sun High School located down here. One of the primary reasons for that is the well water in this area can be very hard, and the school spends a lot of money on maintenance on the mechanical equipment with that well water. Plus, they have to spend a lot of money keeping in compliance with well and septic issues. So they have talked to us before about extending water and sewer to their locations. Calvert Manor nursing home has also sent us a letter requesting services, water and sewer out there, because they have upwards of 100-bed waiting lists for seniors looking for housing. And they have told us that if they could get off of the well and septic, they would expand the building to put more beds out there. The other area of interest is 2 residential properties that are right across the street from the gas station out on 272 that have been battling well contamination due to a leaking fuel tank at the gas station that dates back to the 1990s. Interestingly, there were high VOC levels detected in those wells as late as November of 2018. And later on in some other presentations on our master sewer and water plan, we're going to talk about how we think there could be a value of, if water is extended out to those areas, we could get those 2 residential properties off of there. And here, I'm going to zoom back here, and what I've uploaded is the letters that we have received from a couple of those folks requesting the water and sewer. You have Plumpton Park Zoo, Ramsey, Calvert Manor, and Southern States.
Can I ask a couple of questions
Yes.
at this point, or do you want me to wait till the end? Would you rather I wait? Okay. When were you anticipating moving forward with this? What is the timeline?
We have been submitting paperwork to USDA as we speak to extend the water and the water line out to southern states. We are having ongoing meetings and negotiations with southern states over the last couple of weeks, and we're meeting again next week to discuss the framework of an agreement to deliver that. So given the approval process, we have the financial resources and we have a preliminary financial commitment from southern states. We could see potential groundbreaking by the end of 2019 to begin extending the water out to those areas.
Okay.
So some other service areas that we also have requests to the north of the town of Rising Sun. And 2 of them consist of land that is already in the town of Rising Sun, the Stevens Preserve site, and then Wellington Manor. But we also have a business down on North Hills Drive that has an accounting office down there that has already outgrown the personnel capacity, and they have additional floor space and ability to expand, but they're confined by the existing water and sewer limitations. So they've requested to connect. Out here at 47 Fremont Lane, right up by the state line between right at the corner of Red Pump and Fremont Lane, we have a large piece of land that's essentially been forgotten and abandoned. They have approached us about being able to get water and sewer services to the town also. The other thing we have is we have some water and sewer service requests going to the south of the town of Rising Sun. And those consist of the Rising Sun Elementary School. Again, we've had discussions with the school in the past. The school has struggled over the years with water quality there. They have gotten ahead of those issues, but they are spending a lot of money trying to stay ahead of those issues. Long before I ever came to the town of Rising Sun, I'm being led to believe that this is not the first time that Rising Sun Elementary School has approached the town about providing water to the elementary school. We also have a request from West Nottingham Academy that has been on well and septic for many years. They too have struggled with water quality issues and septic overflows. They've spent a lot of money and gotten some assistance from USDA to try to stay ahead of those issues. But again, they are seeing the value of being able to get on town public water and sewer. And then we also have a request from the Hunter Sale Bond, who after many years is looking to retire and sees a value. His land is zoned BG, and he sees a value and being able to capitalize in the Great Wolf Lodge coming in down in the Perryville area. And his realtor has expressed to him that his land could be valuable and he'd have more flexibility if he received water and sewer from the town of Rising Sun. Again, we have just 2 of those letters there to show.
Would you say that
Yes.
that's the priority? You would see these 1, 2, and 3, east being first, priority number 1, north being number 2, and then south being number 3?
Yes, yeah, essentially. And these service areas are really what are defining the green growth area for the town of Rising Sun also.
And again, Councilman Kautz, I would say that we have to create this plan for the future. This is something that if these people are interested 5 years, 10 years down the road, then we need to know that they are interested. If they're not hooking up right now, then that's one thing, but we do have some users that do want to come onto our system soon.
Well, I have a couple questions. First of all, have you reached out to your neighbors? Have you reached out to the farmers to say, hey, listen, we can bring water to you? Are you interested? And if you have, what kind of feedback have you had from them?
Well, I think that's an interesting question because I think it's really important that the town of Rising Sun put a stake in the ground right here and say, we're not trying to change the rural nature of Cecil County. That's why, although we were originally concerned about the rural legacy stuff, and we'll show that in a second, that we realize that this is a benefit for the farmers. And so we want to be available for people for whatever reason they decide that they want to develop their land, that we are a resource that they can draw upon. There are some farmlands out there immediately adjacent to the town of Rising Sun that our members of our elected body have spoken to in the past. The Meadows Farm has expressed an interest in being able to do some things. If you know, they've created sort of a music venue out there, and our comprehensive plan reflects that effort and the ability for them to annex into the town. But we're not really we don't want to get people concerned that we're trying to turn the area into White Marsh or Bel Air, because that's not our intent. We want to maintain the rural character of the area too. We essentially just want to be a right of first refusal. Here, we need to be able to move our water and sewer, and there are other entities that are far bigger than we are that have a lot of resources that can bring to the table, and if we are not careful, we will not be able to be a player in the world of water and sewer. So this whole presentation is about just staking out an area so that we can be a right of first refusal. If we don't want to serve it or we can't serve it, then somebody can go to another entity to get that water. The other thing that's interesting about the Rising Sun Elementary School is it's no secret that recently the town of Rising Sun was working with USDA to get upwards of the number has changed. It started out as $500,000. Now we're told it's $1 million, where USDA would provide emergency funding to alleviate water quality issues. And given the fact that Rising Sun Elementary School has had a heck of a battle over the years in dealing with water quality out there, we thought they would be an ideal candidate. And when the information was sent to the Maryland Department of Clearinghouse, the county rightfully looked into a comprehensive plan and said, well, this area is in a rural conservation area and no water and sewer can be extended to those areas unless it is a modified health and safety issue. And we get that. We understand that's the way it's written, but we're going to talk later on, and we think that's not in keeping with the spirit of the state law regarding the creation of master sewer and water plans and comp plans as it relates to municipalities having an equal footing and say on what happens in their areas. Basically saying that the county comp plan, as we're going to show, is really boxing us in. But the thing that's interesting is that in the 2010 comprehensive plan that is cited, there is a water services area map in the county comp plan that shows future service area of 6+ years, and this map was done in 2010, and the Rising Sun Elementary School is in the county's map, indicating that it is a candidate for water service in the area. There's another sewer map that matches this also. So we think this is an oversight, and we think that Rising Sun Elementary School is a great candidate to get this emergency relief money, and this is something we would be looking for support from the county on in the future. So then you start to look at, well, what is the town of Rising Sun looking to do? And this is what we would be submitting to Cecil County as part of our master sewer and water plan update. And as you can appreciate, this is matching basically the growth area and the previous annexation plan, meaning that the water and sewer, we're providing the water and sewer to people, and then we're matching that with the annexation plan so they don't have to pay that enormously high water and sewer rate going forward. An interesting thing about our proposed service area here is that when we submitted our paperwork to the Susquehanna River Basin Commission, we had to work with them to establish a service area of the 1 million gallons of water. And this map was developed and approved by the Susquehanna River Basin Commission. And as you can see, it is a massive area that Susquehanna River Basin Commission recognizes as a realistic service area for the town of Rising Sun. As we showed you earlier, we're only looking right now to update the master sewer and water plan to show this area within the green area. And then furthermore, we are looking to create that area of right of first refusal. And what this basically is in the area of right of first refusal is basically coming down the 276 corridor to pick up West Nottingham Academy and then continuing over to where Theodore Road comes out to 276 and then extending east over to Washington Road, heading up to 274 and then picking up some area on the east side of 274, then extending over Calvert to pick up the areas that we talked about previously of Calvert Elementary, Calvert Manor, Rising Sun High School, and some other areas. So that is what we are requesting as sort of a franchise area. And when you compare that to the SRBC map, you can see that the town of Rising Sun is not looking to be greedy. That's not what we're doing. We're looking to be realistic. The other important thing about this service area is that many and most of this land is already developed. We're not looking to open up a floodgate of people coming in and taking land and developing it. We are recognizing, we've all heard it before, people talk about failing wells and failing septic all over the place. We can never pin it down, but everybody alleges that there are some issues. We're trying to position ourselves that if people have those issues, we can provide that water and sewer. We're not looking to develop those areas. We're looking to provide the service to those areas as opposed to a for-profit being able to come in and reap the benefit. Because again, remember the numbers I gave you financially. 2,800 people, 900 homes, paying for $26 million of infrastructure financing. The numbers just don't work. Interestingly, when you talk about this requested service area, you then ask the question of, well, does it encroach upon anybody else's service area? And this reddish pinkish area is the service area for the town of Northeast. Here is some service areas that are open between Elkton and Northeast, but the important thing is we're not encroaching in anybody's service area. We're not looking to encroach upon their service area. We're just asking for our portion of a service area that can help make us sustainable in the future. The other thing you're going to notice about the service area is that the town of Northeast and these other areas beyond the incorporated limits, and the redder area encased, the green area encased in red is the incorporated limits of the town of Northeast. But yet they're showing service area out and beyond, which is typical. But they're not telling anybody what the development will be out there. Those communities could annex into the town of Northeast, and the zoning could be whatever the town of Northeast decides that it should be. So I want you to keep that point in the back of your mind. The sewer service area is a lot more straightforward. It's basically just going to mirror. It's basically just going to mirror what the town has already. This is the existing county master sewer and water plan that's in the county's plan right now for the town of Rising Sun. We are looking to, again, follow the growth area boundary. We are looking to extend it. Again, these extensions are related to people asking us for assistance in their areas. So the sewer plan is a lot more straightforward. The next item that I'd like to cover is the one that I think gets a lot of attention and concerns people. With all of this annexation and service area in the future, what is northern Cecil County going to look like? What would the impacts be on this? So as we talked earlier, here's the town's comprehensive plan. Here is the town's requested service area. And we are going to take it one step further, and we are going to create in our comp plan zoning designations for these areas. Now, the thing that's important to recognize in these zoning designations here is that the town of Rising Sun is also going to create new zoning districts that are going to essentially match what the county already has in their zoning plan. So the county has a rural residential designation. The town is going to adopt a rural residential designation with the same limitations. The county has a village residential. This is very similar to the town's existing R2. The county has a northern agricultural residential. The town is going to create a rural estate residential that will have the same 1 house per 10 acre limitations on it. The county has a suburban transition residential. That's similar to our R2. Low densities are R1. And we have a match for everything the county has. The county has a business general and a business local. Those zoning designations are very similar, so the town is just going to designate those areas as rural business for that. The county has a light industrial and a heavy industrial. The town does not have a heavy industrial. It has a light industrial, and then obviously we both have open space here. The thing that's interesting about this is when you compare this to the county's existing overlay, this is a snapshot of the county's zoning code or listed on Cecil maps. And the green is the NAR. You can see the county's rural residential is hash blue lines. There's some standard traditional in here. But when you compare that with what the town of Rising Sun is doing, you see the colors are essentially staying the same with some exceptions that I'm going to highlight. So again, we're not looking to turn this into Bel Air, whitewash, and concrete all over the place. We want to maintain the rural nature. And when you look at the proposed land uses, there are some areas where the town is recommending some changes, and they are predominantly in and around the town of Rising Sun itself. And the green area represents area that the town is actually proposing to lower the density levels, to lower the intensity, to take standard residential, which is 4 houses per acre, and drop it down to 2 houses per acre. So the green areas are where we are looking to step it down. The whiter cream-colored areas are where we are looking to step it up. And we're looking to step it up on the Route 1 corridor because that is ideal for a business corridor. There is business general listed in that area, and there is some NAR listed in that area. So we're proposing to upzone it to an employment zone. And an employment zone, we want to be able to create things like the county does, like enterprise zones. We want to create an employment zone that would attract businesses to make good developments in the town of Rising Sun. So the other interesting thing is when you look at the proposed land use, and I talked earlier about the town wanting to preserve open space, here is the town's efforts at creating green belts. We are making our comprehensive plan that if those properties that are not in the town of Rising Sun wish to get water and sewer services from the town, and they wish to annex into the town, they're going to be confined by the same zoning that the county has already set forth. And we're going to take it one step further because we are going to designate large areas as green belts because we want to preserve the beautiful trees and the natural water features. So we're carving up a lot of that area and reducing it even more and doing our due diligence to preserve the rural nature of Cecil County as well. Then when you look at these areas and you look at when it's all said and done, this is the green belts and the stuff that's currently zoned NAR, which would remain in the town of Rising Sun. These are the areas that are either already developed or could be developed, but they could be developed at densities that are either already approved by the county or would be reduced under our zoning efforts. So the last thing I'd like to cover here, and this is really the reason why we are here, is to look at the impacts of the county's comprehensive plan and some of these, the language the hurdles that the mayor talks about. So here again is the town's annexation plan. Here is the town's proposed water service areas, which matches our sewer service areas. And back in June of 2018, the state and the county created a rural legacy area. And we've had this discussion before. I'm going to take some of these items out. So you have the June rural legacy area. This legacy area extends further over to the eastern part of the county, but for the purposes of this, I didn't draw all of that in here. So in June, the 2008 rural legacy was done, and that's what it was as of June. And then in July, another amendment was made, and you can start to see that the rural legacy is starting to encroach around the town of Rising Sun. And when you take the town's annexation area map out, and remembering this dog leg here is what was in the town's comprehensive plan in 2005, it matches what the county talked about in the past. A little frustrating that the rural legacy was put right up into those, basically in our backyard in those growth areas. But again, given the fact that it is a voluntary program for farmers, we don't have any concerns about that. We want the farmers to be able to maintain their rights. However, the big problem here is in the county's priority preservation areas. So you see, we've talked about how vital it is for the town to be able to move this water and sewer. We've talked about our growth area and what we'd like to do, but the county has a rural conservation area that says no water and sewer can go into those areas. How is the town of Rising Sun supposed to survive financially with that? Are we suggesting that the rural conservation area be taken away? Absolutely not. What we're asking is, can we have a meeting of the minds that carves out a compromise that doesn't create the unintended consequences of the town of Rising Sun having a very difficult time and being able to survive going forward? The interesting thing about the priority preservation area is that these areas here represent rural residential, business general, developed areas. So we understand that when you're putting maps together, it's not always an exact science. You make a map. And in this particular case, there's rural conservation areas that are overlapping areas that the county has said can have 1 house per 3 acres, that the county has said they can have 4 houses per acre. So the rural legacy, there's some anomalies in that. So in summary on my end, what we wanted to accomplish is we wanted to show you our comprehensive plan, and we're looking to grow consistent with what the town talked about doing in the past and then what the county had in previous plans. We wanted to talk to you about our master sewer and water plan and the real interest that people have of being able to get water and sewer. That region has been stifled for over 12 years. You can document the reductions in property values compared to the rest of the county. And water and sewer is the driving economic engine that makes that happen. So we wanted to show you what our master sewer and water plan would look like. And then we also wanted to show you that what we're looking to do is not change the rural character of Cecil County. I say that over and over. That's not our intent. We want to preserve it just as much as anybody else does. And we want to be able to be the right of first refusal of anyone who wants to develop their land within the parameters of what the county has already said they can. We just want to be the player in the market for somebody to come to and talk to us so that we can be sustainable going forward. So thank you for
And
your
I
help.
can add to Calvin that when you look at this priority preservation area, this is unlike any other town in Cecil County. We're basically surrounded by the red, as you can see. For Rising Sun to stay successful as a town in Cecil County, we are going to have to develop. We want to keep our small town charm. We want to keep our area as an agricultural community. However, we will have to develop. It's going to be a strong burden on our taxpayers and citizens of Rising Sun if we're not allowed to move forward with this.
Well, and you both realize that there's hurdles. You have about 3 big hurdles to go over, and the council, we're not one of the hurdles, as you know. But between the county and the county executive and MDE, I'm sure that you will come up with a solution that'll help everybody. But I just want to tell you a very excellent program today, what you presented, the way you presented it, and I see you have a lot of backing from the town of Rising Sun, which I think is great when you do something like that. Let me see a show of hands, everybody from Rising Sun. See, that's nice. That's really nice when you come in here with that. But I'm sure that everybody's going to get together in one room and, you know, you'll get it figured out.
And if the county council would like to have any copies of those letters, we can certainly provide them to you.
That would be great.
Another thing that was a little bit of interest was along the area where Southern States water would be provided. We're not looking for any easements from farmers. We are looking to stay within the state highway right away if we were able to bring water up to Southern States.
And I have one other question. I think you mentioned it, but I want to reiterate. When you come, if you said, okay, fine, you got the green light tomorrow, you have the financing in place to do the project, the first phase? You already have that funding?
Yes.
Okay. Council, is there any more questions? Again, I want to thank you both for your presentation today, and we'll move on with Mr. Massey.
Thank you. Thank you.
Thank everybody for coming today.
I'm addressing the state legislative update. In your packet, you have a chart of the state legislation that we've approved for or taken a position on. We've updated it. Senate Bill 132 regarding the horse racing at Fair Hill has passed in the Senate and has gone on to the House, assigned to Ways and Means, so that's a good thing. And Senate Bill 259 regarding the special taxing districts for broadband passed the Senate and has been, it's gone to the House, assigned Ways and Means. And then there's several public hearings today. House Bill 166 regarding the minimum wage, which we opposed, has been given a favorable report with an amendment. I want to defer to Jackie or Ms. Gregory about possible new legislations to consider.
Okay. So last week I don't want to spend a lot of time on this because I spent a lot of time last week, but I wanted to see if you all had any questions. I gave you guys packets last week about some things. There were a bunch of different gun bills which were actually heard yesterday in committee, and I think we should I think that we should definitely send a letter in opposition to the new gun restrictions that would affect a lot of our citizens. There were some other things that had to do with, and if you have any questions, just let me know on some of the things I brought up last week. One of them had to do with the funding for school construction, or really other construction too, but changing the costs or changing the amount that the state would provide in order to have prevailing wage from 25% to 50%, which is what it used to be. So that was another one. So does anybody have any questions on any of the bills last week? Are there any that you would want to consider us sending letters of support if you want to, just because right, the guns, opposition to the gun bills. Is everybody?
Yep.
Okay.
We're good.
All right. And there was another one that was brought up about like styrofoam and restaurants and things like that. So I would say we should oppose that.
Yeah, in opposition.
and maybe support for the prevailing wage, bringing it back up to 50%. Is everybody okay with that? Okay.
Is that in opposition to?
No, well,
Support
support
for,
for that
okay.
one. Yeah, Maker's asking for support for that.
Okay.
List that you said, I thought was.
Well, I didn't know whether we had time to get into that or not. That's why I let.
Probably wait for details on some of the others if we want to do it next week. I think it's okay.
Sure.
It's not going to be passed immediately, so. A lot of them are still in committee.
Okay, Mr. Massey, I'm going to call for a motion for adjournment now. So could I have a motion, please?
So moved.
Second? Second. All those in favor?
Aye.
Opposed? Meeting's adjourned.